I am Dr. Sathish. I am a senior consultant surgeon in the Department of Minimal Access Surgery, Metabolic Surgery and General Surgery at Columbia Asia Referral Hospital, Yeshwanthpur, Bangalore. Bariatric surgery or metabolic surgery, as it has recently been renamed, is a procedure which is being performed on patients who are obese or in super obese. There are various classifications, but the most commonest is the bariatric surgery is recommended in patients who are overweight beyond 27.5 BMI. BMI is the body mass index. And they should have associated comorbidities with such a shorter BMI. But patients who are overweight or obese, say they have a BMI of about 30, 32.5 or 36, in such patients, even if there are no comorbidities and if they have failed all weight loss measures like diet, exercise, vigorous physical activity, vigorous exercises, and still they continue to gain weight at a rapid pace, then they are candidates to undergo a metabolic surgery or bariatric surgery. There are various forms of bariatric surgery like a sleeve gastrectomy, in which the stomach is converted into a small tube. The capacity comes down to almost 100 ml. So the patient will be able to take only about 100 ml of liquids for the first 6 weeks every hour, and then subsequently he migrates on to a liquid diet and then a soft diet. But one downside of sleeve gastrectomy patients is this, that they are likely to regain their weight. That is because the stomach, being an expansile structure, can expand over a period of 3 to 5 years, and then the patients will have a failure of weight loss or weight regain. The other procedures that are there are gastric banding, then a Roux-en-Y gastric bypass, mini gastric bypass, and so on. There are a lot of developments that are taking place in the field of bariatric surgery, and it's an ever-evolving field. The Roux-en-Y gastric bypass is usually performed in patients who have a higher BMI and other comorbidities, more commonly diabetes and metabolic and hypertension. In such patients, the diabetic resolution is enormous. The patients can go off the diabetic medications or they can come down on their diabetic medication. Some patients have also noticed great change in their lifestyle. And the other procedures like the gastric banding and mini gastric bypass are the other procedures which can be performed, but of course in isolated centers the gastric banding is being performed, and not many surgeons are doing this, and the gastric band is actually going out of work. Mini gastric bypass is another novel procedure which gives us very good results as far as the weight loss is concerned. Of course, as with other surgeries, there are a little complications which are seen with any of the bariatric procedures like hair loss. There can be multivitamin deficiencies. They need to have long-term vitamin supplements. Hair loss will be a temporary one. They need not be concerned. But if you see, the advantage of metabolic surgery over the disadvantage of not getting done is more, in the sense that lifestyle changes need not be required. A great deal of patients would always be concerned whether they would be able to eat, they would be able to perform physical activity, whether they would be very weak. Such things are a wrong notion. There are a lot of patients who have developed a lot of benefit, and this can be performed through a laparoscopic method. That is about 4 or 5 holes, and it's about 2 days stay in the hospital. Of course, after this surgery, the patient has to be on a constant follow-up with the surgeon because we have to monitor their weight loss. Sometimes the patient gets the surgery done and off they go, and they regain their weight and come back. That's a failure from the patient perspective. It's not a failure of the procedure. Bariatric surgery is actually a boon for all obese individuals because once they start losing their weight, they will be very well accepted by society. They will be able to do their own work independently, and of course, they can resume their work very fast. Bariatric surgery or metabolic surgery will allow the patient to get back to their normal lifestyle at the earliest.